Okay, so let's look at question here in question number 39. As noted on the screen and in your course area, it says a physician performed an arthroscopic lysis of adhesions and shaving of the articular cartilage of the right knee on a Medicare patient. The CPT codes for these procedures are 29884, RT, which is defined as arthroscopic knee surgical with lysis of adhesions, separate procedure. That's an important piece of that code definition. And 29877, RT, arthroscopic knee surgical debridement / shaving of articular cartilage right knee. So there's two competing concepts. Both of them are concepts of CPT, the coding system. The one concept, however, is more important than the other. The first concept is we want to capture documented components with as many CPT codes as needed to ensure that the surgeon gets paid appropriately. In this case, the clinical information tells us the patient had a lysis of adhesions and shaving of the cartilage of their right knee. However, when we go to the CPT coding manual, we see two very important words called separate procedure. And we should know, based on our previous education and experience with this particular coding system, when we see those words separate procedure within a code descriptor, that means that the only time we apply the lysis of adhesions code is if that's the only thing that was done. If for whatever reason, whether it was planned or it wasn't planned, all they did was lysis of adhesions. In this case, however, that's not what happened. They did do lysis of adhesions, but then they did the shaving. We are reinforced or reminded that that is a important concept, especially for a Medicare patient, because of the Medicare CCI edit. The Medicare CCI edit says 29877 is in column 1 and all of these codes are in column 2. What does that mean? Based on our education, we will recall that that means that this code, in this case 29887, includes all of these codes. So if you want to assign 29877 because of your clinical information that you're coding from, you should not be using any of these other codes with it. This code 29877 includes all of these codes if they all happened or if one of them happened. And so in this case, 29877 includes 29884, and you should not be assigning it alone for this piece of clinical documentation because that's not the only thing that happened, or you shouldn't be assigning it at all because it's already included. So we want to capture, yes, this patient had the shaving of their knee done, which is 29877, and then based on CPT guidelines, the separate procedure terminology, based on the correct coding initiative, the physician is not going to get credit for 29884. It's included, it's integral. The word integral is what they often say. And if we were to code both of them, it would get kicked back as an error. They wouldn't pay us anything. If we were to code just the 29884, the physician's not going to get paid enough because the lysis of adhesions is probably not as surgically elevated in expertise level as knowing how much to shave of a patient's cartilage. So the correct answer for this particular clinical piece of information, when a patient has an arthroscopic lysis of adhesions and an arthroscopic shaving of the cartilage of their knee, the only code assigned is 29877. That separate procedure word is a signal to say, I like to be by myself. I don't want any other CPT codes, at least within the 298 arena. And no, actually, there's 206 on there, but I don't want any of these other codes to be coming with me. I want to be billed or on a claim by myself for the most part if it's a knee surgery arthroscopic. And at least on that knee. Now, if the patient if it was two knees being done at the same time, that's a whole different set of situation. There are cases when all they do is license of adhesions. Perhaps the patient is very sensitive. They've had pain for a long time. Maybe they have severe adhesion buildup because you can have levels of adhesions. And they have a high level of adhesion built up. Maybe they had surgery in the past on that knee. Maybe they had an injury after they had surgery, and that's why they got all this buildup of adhesions or scar tissue. And the intention when they go into surgery is to just break up those adhesions, to give the patient some pain relief. The other reason typically that we might use 29884 is when it really wasn't the intention. They were going in there to figure out what was going on with the patient's knee. They saw these adhesions, and as they are working to break them up, the surgeon is trying to go through. They're literally cutting and pulling the adhesions apart. The patient's blood pressure drops, or something happens to the patient clinically. Their blood pressure drops, or their blood pressure goes up, or something happens, and they decide to stop the surgery. They don't get to go beyond the adhesions and see what else is underneath them because the scar tissue is covering up what may be the real issue. Or it's covering up another issue and it's adding to the patient's pain. But because of the patient's reaction to anesthesia or whatever, they can't continue the surgery and all they get to do is the license of adhesions. Then in those cases, yes, we would code 29884 because that is all that happened. But it can happen because it was an accident in a sense, not an accident, but they had another intention and they had to stop the surgery. Or the patient, let's say the patient has had multiple knee surgeries over their lifetime and based on the x-ray, the MRI, they see all these adhesions and they're like, let's go in and clean those adhesions out. But in this case, since those two things happen and one is elevated from a reimbursement, the shaving is an elevated procedure. It's going to give more money to the surgeon, and CPT is telling us, and the correct coding initiative is telling us that 29877 includes 29884. Your second question had to do with, do I think it's necessary for you to purchase the Memorex flashcards too? I can't really answer that definitively because I don't know your personal situation. I don't know your financial situation, and I don't need to know that information. You're an adult student. You need to make those decisions appropriately. You certainly could create your own set of flashcards at a very low cost. All you need is a set of index cards and a writing instrument. And you could make your own flashcards. You put a concept or a prompt question on the front side and you put the answer on the back. Creating your own set of flashcards is time consuming, but it also is another way of reviewing and studying this material that you've already been exposed to. In addition to that, if you go into the course, in the upcoming modules, not this module specifically, because right now we're talking about week 2, but in module 3, I actually give you flashcards here. You click on this, you click on this. This will download this to your personal computer. For this, if you print these out, you wouldn't print out slide 1 perhaps, but if you print out slide 2, You could decide how you're going to print it. And you could print, or you could print like in this format here, so 6 slides, and then you could cut each one out. One piece of paper, you would have, 5 slides. You could cut each one out and you could fold them. You would have the question on one side of the fold and then the answers on the other side. And you could, download this presentation to your personal computer and you could add onto it. You could create, add more slides. Go to the end and just hit new slide, and you could add more slides and create additional questions beyond 12, and then you would have more to the slide deck, so to speak, or you could make a separate slide deck, using index cards, whatever you want to do. And that is a low cost way, perhaps less time involved. You'll have at least 12, at least 11 flashcards. The only thing is the printing cost, right? The actual printer ink cost. So again, you have to make those decisions as an adult student. I give you multiple options. As I've said before, the key, I think, for many students, and nothing is 100% 100% correct, because everyone's a little bit different. And we all perhaps learn, if I have 5 students in front of me, they all perhaps learn differently. They all perhaps in this case have different domains that they need to focus in on to help them pass the RHIT exam. So nothing is going to work for every student. And I can't say you have to do this and this is going to be a guarantee. Unfortunately, life doesn't work that way, and learning doesn't work that way. Learning is dependent on your time and your place, and we learn differently as we get more experience in life and get more experience as a student. But studies have shown that if we write things down, we have a tendency to remember them better than if we just read information. Making flashcards, making them yourselves could be advantageous because of the time it does take to make them. But again, if you're short on time, and I don't know exactly, I have no idea what the flashcards cost, the ones from this particular company. And so you have to weigh all of those things. That's part of being an adult student. My recommendation, because of what I've seen, the majority of students that have communicated to me that didn't pass the RHIT exam, they didn't pass it because they didn't answer all of the questions. They literally, didn't answer 20 questions, or they didn't answer 30 questions. And those questions were then scored incorrect as being wrong, even though they didn't answer them. They got 0 points. And so that is what made the difference between them passing the exam and not passing the exam. One of the best ways I know for you to meet that challenge is to take mock exams and time yourself. If there's a particular domain or area that you need to study more intensely, flashcards can be very helpful for you to bring up your comfort level with that particular area. But the key is perhaps always going to be, yes, you know the material, but did you take the mock exams? And you have mock exams in the hard copy of the prep book. You also, I believe, from what I understand, you have access to an online area where you could potentially, using the software that AHEMA has, you could potentially create additional mock exams or mock exercises that you could practice on. The key is timing yourself. The average time per question is about 1.5 minutes on the actual exam, but you can start out higher. You can start out giving yourself 5 minutes per question. So maybe you create a set of questions, or in the review book or the prep book, you say for domain 1, or even for the practice questions, they have, I think, over 120 practice questions. But let's say you're going to sit down and you're going to take, this is domain 1 practice questions. So they have over 110 practice questions. So let's say you're going to sit down and you're going to do the first 50. And you want to time yourself. Maybe the first go round, you don't time yourself. Maybe it's the second, third go round. But you're going to give yourself 3 minutes per question. That means you're going to give yourself 150 minutes to take those 50 questions. That's 3 minutes per question. But you could even start higher. You could time yourself and say, I'm going to give myself 750 minutes. That's 5 minutes per question. That's a considerable long period of time. That's over 12 hours. That might not be realistic. But let's say you want to give yourself, 3 hours. But if you were going with the national standard, you would give yourself an hour and 15 minutes to do 50 questions. That's 1.5 minutes per question. And so you need to time yourself. I would suggest you start at a higher time, like 2 or 3 minutes per question, and only take so many. Don't try to do all 110 questions in one sitting. Perhaps do the practice questions without timing yourself, especially for domain 1. As I said in a separate video, domain 1 and domain 4, because those are the 2 domains that have the highest percentage of questions on the national exam. Once you see where you are, then you can start using the flashcards. Then you can start, go back after you use the flashcards. Then you take another mock exam, and then you start timing yourself. But you want to get down to closer to 2 minutes per question. So that would be my suggestion. How you get there is up to you. When I was a student, after medical terminology, I did create my own flashcards in medical terminology because we didn't have any avenues to buy them at the time. We had to create them. We didn't have any choice. But after that, I started just using a regular notebook. This is a legal pad, right? And I would write the question on one side of the paper, and then I would tear it. And I think I tore one already. So then I would tear it at the top and fold it over like this. And then I would have the answer here. That's a type of a flashcard, even though it's in a linear format.